Welcome to this video of presentations from the third Global Mental Health Summit. The Summit is a meeting of the Movement for Global Mental Health, an organisation of approximately 3,000 individual and institutional members from across the world who are committed to improving mental health, particularly in low and middle income countries. The meeting was held in Bangkok in August of 2013 in association with the World Congress of Asian Psychiatry and consisted of 4 sessions. The first session was focused on the contribution of mental disorders to the overall burden of disease as part of the Global Burden of Disease study, and also a presentation from the Director of Mental Health at WHO in Geneva on the Comprehensive Action Plan which was adopted by the World Health Assembly in May 2013.
So somehow we haven't got a method yet that's sophisticated enough to pick up what it is about people with mental illness that causes them to die prematurely. So rarely is depression the cause of death, or anxiety the cause of death, or even schizophrenia the cause of death. It's death by intentional self-harm, i.e. suicide.
The importance of comprehensiveness. You can't just quantify the conditions that are easy to quantify. For public policy, you need to quantify a vast number of conditions. Informed estimates are better than no estimates, because often in public policy, no estimate equals no problem.
This shift from communicable to non-communicable, and from premature mortality to years lived with disability.
There's an urgent need to promote policies and programs aimed at avoiding premature deaths of adults. We can't just as a global community keep babies alive till adulthood. We need to keep adults alive into old age, and we need to keep them healthy by reducing chronic disability. Living longer, but we're living more and more of those years with chronic disability.
The second session was focused on inter-sectoral partnerships, on regional programs for mental health system development, and the contribution that international NGOs can play in developing comprehensive mental health services.
We set up the task force secretariats to support and to help the national task force to do activity of the task force plan. Based on the training in Melbourne University, the CIMH will bring and transfer this training to Vietnam.
We would like to strengthen the international cooperation in the mental health care, to coordinate with international partners to pilot and replicate community-based rehabilitation and care model and the service for the people with mental problems.
The third session of the summit focused on mental health and human rights, with a specific example from Indonesia of a program designed to eliminate restraint and confinement of people with mental illness in community settings.
From the survey in 2007, the prevalence of the severe mental health disorders was nearly 1.5%. It's about more than 1 billion people.
Asung means a physical restraint or confinement of the mentally ill, but just only in the community, not in the institution.
So estimation of the people who are restrained physically were 18,800 people.
Duration of Pasung is quite vary from days until years, but from the last research done by Procminas in 2011, the average is around 4 years. Because of the negative perception about illness, most of Indonesian people thinking that this is because of supernatural problems.
The most important thing is we want to promote and bring kindness and compassion as a powerful resource to fight stigma in Indonesia.
The Center for International Mental Health at the University of Melbourne has been involved since several years in the Free from Pasung program in Indonesia. And a couple of years ago I started working on a photo and film documentary project called Breaking the Chains, which explores through photography and film what is the issue around Pasung, why some people are kept and the physical restraint, and more importantly, what are some of the on-the-ground activities carried out in the country, and in Cheongju in particular, to eradicate this practice. You will now be watching some clip from this documentary.
I want to make somebody cut this and just make it over. There is no goodness, so you have to help me.
Ini punten Pak.
Lahiran tahun 80.
Terus adanya Rios nyambung ke
itu udah taranya Rios ayeuna mah.
Rios baheula dulu-dulu masuk kapungkur eta nya Rios nya.
Biasa upama dangdutan teh masuk nurutan anjeunna teh nya.
Nurutan.
Biasa nadom itu ya teh jempling we.
Pami terlepas, nah tamang kali ya terus gede
lain. Kalau karena jin dan guna-guna masa obat jin takut sama obat. Ini contoh jinnya lalu lompatan manusianya yakinnya. Itu kenapa sekarang baik? Karena obat. Ada yang obatin. Cuma ketika Kikin melihat itu ingin menolong. Kikin juga ingin menolong.
The fourth and final session of the summit focused on the organisation of the movement for global mental health itself and how it should develop into the future. We need to focus on what are the enabling conditions that we have to create in order to ensure a certain set of basic and absolutely essential freedoms to enhance the capabilities of people to live lives that they consider worth living.
Mental health is a part of what everyone else is trying to achieve anyway, as opposed to being a vertical, separate, siloed component of development. We're a part of the development movement and integrated into what other people are doing. Poverty and mental ill health are inextricably linked, and development is not going to happen unless we deal with the issue of mental health. Most important of those probably is around equity. It's about vulnerable people being brought up as well, not just having targets that are average achievement.
This conference was the third in a series of global mental health summits of the Movement for Global Mental Health. It sought to highlight the relationships between an understanding of burden of disease, the role of human rights as part of mental health system development, but also the importance of collaboration between different sectors and different partners in contributing to mental health system development on a global scale.